Before the lockdown, this A&E ward was being threatened with closure in South Wales, and it's leaving locals who depend on it worried for their families. The coronavirus pandemic has put a shadow over the health service here. The National Assembly's focus has drifted from local issues, and that includes the possible closure of the A&E unit at the Royal Glamorgan Hospital in Llantrisant. Resident of Llantrisant, Kate Mantle, tells of her son who was diagnosed with a condition that left him unable to breathe properly on his own.
One particular day, I gave up my job as a teacher, so I was doing supply. He wasn't 100% in the morning, but he wasn't ill enough for me to not go into work. He was okay. My parents were looking after him. By lunchtime, I rang my mum. She said, I think you'll need to take him this afternoon, to the GP. He's not 100%. And within 10, 20 minutes, my mother was on the phone and they were basically driving him to the hospital because they couldn't find a pulse.
Kate's son was saved by the emergency staff at the Royal Glamorgan Hospital and has been treated there several times since.
Without having that on the doorstep, things could have been very different for him because he was in and out a lot with chest infections and struggling with his breathing, really.
The possible closure of the Royal Glamorgan A&E was first presented by Cwm Taf Health Board at the start of this year. The proposal to downgrade followed a report that A&E waiting times in Wales had hit their worst levels yet. The report said that 75% of patients were admitted or discharged within 4 hours in Welsh hospitals, but this didn't meet their target of 95%. In the same report, it said over 5,700 patients spent longer than 12 hours in urgent care departments in September 2019, just a few months before this proposal was presented. Before the coronavirus lockdown, residents of Rhondda Cynon Taf and members of the Save the A&E campaign were protesting the proposal weekly. The possible closure has made people here in Wales consider the pressures that the Welsh NHS is under. There are also concerns for how it's being managed. Those who rely on this service are asking what role the National Assembly in Wales are playing in this, considering the devolved Labour government here in Wales are in charge of health policy.
This acts over the future of our accident and emergency department.
It is operating within a context of 12 years of austerity, of course. And also, the Welsh Government has to take responsibility for failing to plan the workforce properly. It's not too late. There's still a lot they can do in terms of recruitment. Other places are recruiting. Yes, there's a shortage, but there shouldn't be the shortage to the extent that we've got here. It's simply unacceptable for our people to be operating under the level of consultant cover that we've got.
Earlier this year, Cwm Taf Health Board confirmed that the Royal Glamorgan is short of 10 consultants and its only full-time consultant is leaving this month. These numbers are showing a serious staffing problem at this hospital, which coincides with the fact that there are more patients using the emergency services at the Royal Glamorgan Hospital each month than use the Prince Charles Hospital in Merthyr Tydfil. Together, these hospitals have seen nearly 125,300 patients over the last year, which is an average of 10,440 patients a month. This has left residents of Rhondda Cynon Taf, like Mary Davis, who uses the service frequently, concerned about what will happen to them if their local emergency room is downgraded.
I've got multiple myeloma, which is cancer of the blood. It's just lucky that the Royal Glam is there where it is, and especially the A&E, because the paramedics pick me up. I know exactly what it is. I tell them it's sepsis. My temperature goes over 39, and they just take me straight through to a cubicle.
If the A&E service were to close, residents of Rhondda Cynon Taf would need to use alternative emergency units. These would include, and likely be, the Prince Charles Hospital in Merthyr and the University Hospital of Wales in Cardiff, but these facilities are a lot further to get to than the Royal Glamorgan, which could result in a higher risk to the most vulnerable in South Wales. To travel from the Royal Glamorgan Hospital to the Prince Charles Hospital in Merthyr would take an average driving time of 40 minutes. This is longer than the average time to get from the Royal Glamorgan to the University Hospital of Wales in Cardiff, which would take an average driving time of 22 minutes. Steve Bennett is a paramedic at the University Hospital of Wales in Cardiff. His team are concerned about the pressure that will be put on their unit if the Royal Glamorgan is no longer a 24-hour service.
Is there any worry that that could lead to more pressures on your team moving forward?
It will, because from where I work in Blackwell, so I work in central Cardiff, and we cover Craiger, Penturk, where else, Groesfane, and of course, because it's Hensel and sort of the furthest part of the Royal Glamorgan, we actually run into the Royal Glamorgan. So for us, if they start to close or downgrade the services at the Royal Glamorgan, then we've got to send our crews either down as far as Princess of Wales, which is already struggling with the amount of calls and patients they get, or Prince Charles. Of course, we're taking then ambulance crews out of the capital city, so it's stretching their already stretched emergency services.
While the coronavirus lockdown continues across Wales and the rest of the UK, the future of the Welsh NHS and closure of this A&E at the Royal Glamorgan Hospital still hang in the balance, and it does not look like this is being resolved anytime soon. Amelia Green, Llantrisant, South Wales.